Hello student, this is Jitendra and we are taking the topic today from the renal system. That is the uh, that is the topic from adult health nursing first, which is from BSc third semester. So what is urinary tract infections? So we will have introduction of it. So what does mean by it? Urinary tract infection, it is the infections which occurs in the part of renal system. Now we'll see what is the renal system. We have the diagram in the slide here, so we will see this diagram and what are the parts or which are the organs which is connected with this renal system. So before having a glance on it or giving the explanation of it, we will try to know what does the renal system uh, work have in the body. Renal system has the excretory function in the body. Whatever the food and things we eat, that these food and things which gets digested by the metabolic process that we have in our body, and after the digestive process getting over, then we have certain elements or the minerals as the excess. These minerals come through from this renal system, uh, from the renal system to out of body. So it is very important to have the renal system in proper functionability condition or in working condition. So this is the part of the renal system. In the renal system we have two kidney, two ureter and bladder and urethra. The filtration of bloods occur in the kidney. That means in the kidney glomeruli, the glomerulus that we have. So there, the filtration of that occur. 99% of the blood which goes back to the uh, intravascular space, and 1% drained out as the urine from the kidney to the ureter, from the ureter to the bladder, and from the bladder to the urethra. So now the infection, if that occurs in the part of the renal system, it known by that name. uh, for example, uh, uh, um, for example, we have um, we have the classification of the CUTI. So classifications we have in the two form, like upper urinary tract infection and the lower urinary tract infections. When the infection is occurring in the upper urinary tract, that means if it is occurring in the kidney, it will known as the nephritis, or it will be known as, if it has happened in the part of the kidney like glomeruli, it will known as glomerulonephritis. If it occurs in the ureter, it will be known as ureteritis. And if the infection occurring in lower urinary tract infections, that means in the bladder, in the urethra, it will be known as the urethritis or cystitis. So likewise the classification of the urinary tract infection occurs. In many books it is given like acute urinary tract infections in the lower urinary chronic urinary tract infection. So acute urinary tract infection is sudden immediate uh, onset of the infections which occurs in very uh, urgent form and very short duration. So that is called as acute. When the infection occurs gradually, it takes the time, it takes the long time, and it has some secondary cause, then it will called as the chronic urinary tract infection. After that also we have again classification of, like in many books it is given like complicated urinary tract infection, uncomplicated urinary tract infections. If the infection is occurring in the upper part of urinary tract infections, because the with the times and with the times resolution of the infection is not done, then it can lead for the further implication, further problems, like the infection is in kidney. or renal pelvis. If it is not resolved with the times, it is not controlled with the time, it can lead for the glomerulonephritis or and certain problems that be very serious. That's what it is called as complicated. And if the infections occur in the lower urinary tract infections, so these infections, if it is not resolved with the time also, it does not uh, uh, be reason for the major problems. That is the reason it is called as uncomplicated. So this is the classifications that I have explained before you people. And uh, and whatever the book you will refer, in that you will see the classification according to that only. Now we'll have the causes. What is the etiological factor that can lead for the urinary tract infection? So we has the bacterial causes. So whatever the urinary tract infection occurs, among them 80% cases of the UTI are of E. coli infection. That is one kind of the bacteria which is responsible for the major infection UTI. So 80% of cases of UTI are seen of E. coli, and after that remaining 20% cases are seen of enterococcus, klebsiella, enterobacter, protease, acidomonas. And with that other etiological factor also we have that lead directly or indirectly for the UTI, urinary tract infection, like failure to empty urine completely. Certain conditions, certain ailments we have, in that the person does not be able to empty the bladder properly. In that case the urine gets accumulated over there, and then the multiplication of the bacteria occurs, and that cause destructive changes over there, infection, and thus it happens. After that, any ailments, due to that the person has decreased immunity or suppression of the immunity. Immunity is what that we can say in other word, it is the power of the body which protect us from the infections. So the immunity of the body gets reduced, so that also can lead for the UTI. Other other cause also we have, other reason also we have for the infection, like instrumentation of urinary tract. Certain elements in that the person does not be able to urine, or any problems like the person is hospitalized completely, is in a paralysis condition, is not mobilized. So in that we require to put the catheter. So during the process of catheterization and all, we can have the injury or maybe other reason also. So this injury can lead for the EDI. So so instrumentation also can lead for the UTI. Then other we have obstruction of urinary flow. So what is the obstruction of the urinary flow? So urine which gets flow it from the kidney to the ureter to the bladder from the bladder to urethra. So in between of that, for example, there the calculation formation occurs in the renal system, like in other word we can say the stone. So due to the stone, there may be the obstruction. Due to that the urine does not flow properly, it gets obstructed over there. And maybe certain causes also benign prostate hypertrophy. So the prostate gland which be just behind of the urinary bladder, it puts a pressure over the neck of the urethra and bladder. So usually happens after 45 to 50 years in some people. So that also can lead incomplete emptying of the bladder, and thus it can lead for the urinary tract infections. So these are certain causes that I have explained before you that can lead directly for the urinary tract infections. So now we'll have the clinical features. Clinical features we can see in other word as the sign and symptoms. Signs are those symptoms that is um, observed by the client, by the caretaker, and symptoms are the uh, signs which is um, uh, by the patient itself, uh, is said to the caretaker. So this is the clinical manifestation and clinical features, meaning Now we'll see the what are the symptoms that we see in UTI. A strong persistent urge to urinate. Actually, in generally it does not happens, and uh, when the bladder gets full around uh, 150 or 200 ml of the urine, after that the person has the desire of passing the urine. But here instantly the person has the desire of passing of the urine, so immediately he has urged to void urination. After that, along with that, the person may have like dysuria. Dysuria is burning sensation. That means on the time of voiding, on the time of passing the urine, the person will have burning sensation. So that is called as the dysuria. Other the symptoms are passing frequent and a small amount of urine. As I have discussed earlier, the bladder does not get empty properly, yeah, completely, so that the frequency of the urination increase. Often and often the person pass urine more, and generally the adult person around 6 to 7 times in a day they pass the urine, and 1 or 2 times they pass in the night. But here the frequency of the urination gets increased. Now after that, if the person has the UTI, the appearance of the urination will the color of the urine will get changed. It appears like cloudy. General the person has aromatic the smell or yellowish color of the urine. So amber or amber color of the urine the person has. But here, due to the infection, the appearance of the urine color look like cloudy. And after that, for example, if the presence of the blood, then the urine color appears like red, bright pink. It depends on the how much the blood is present in it, and technically it is called as hematuria. And along with that, the person will have strong smelling urine. It does not usually the person does not have that kind of the smell, that the smell is aromatic, but here the strong foul smelling the person has. And after that, the person may have discomfortness in the pelvic region. Yeah. And the intensity of the pain uh, cannot be measured over here, because the many causes are there, like formation of the calculus is there, and benign prostate hypertrophy is there, certain causes there. So you know, according to causes the intensity of the pain will be. But here just we are discussing about the UTI, what is. So as per the urinary tract infection only, I'm telling this discomfortness, the person will have discomfortness. So nature of the pain, and that will be different, can be different. It depends on the region, what the region the person has for UTI. And the next slide we have for the diagnostic evaluation. Diagnostic evaluation is nothing but it is the diagnostic tools that we use for uh, confirmation of the disease, what the disease that person has. uh, Before going to the before going to the diagnostic tools, certain things we have, like taking of the history, asking the patient from when he has the symptoms, whether he has taken treatment, what treatment he took, or earlier he had. So similar to these things, we ask to the patient to know what the problem actually the patient has. And with that, other things we have physical examination. It may be sometimes related to the particular affected part that we can realize after seeing the symptoms of the person. Or rule says like whatever the problem is, we should do the thorough examination, that is the head to toe examination. Along with that, we have blood routine examination, and that comes the CBC, complete blood count, hemoglobin and all. Under the CBC, RBC count, WBC count, platelet, all these things comes under it. And after that, as the problem is confined to the renal system, or to the or to the urinary tract, so we'll have the urinalysis. So it is the examination of the urine, and that we see the osmolarity, color, smell of the urine. And after that, we can have urine culture and sensitivity test also. This is for the reflection of presence of the microorganism. So what the microorganisms are responsible for the urine infections, so that it is done for that. Then we can go for the ultrasound. It is done to see the structure of the renal system. Like we do the KUB ultrasound, kidney, ureter, bladder combinedly. So any obstruction is there, if any structural damage is there, stasis, narrowness, something like, so we can find out through the ultrasound. With that, we can have the x-rays of kidney, ureter, bladder. If a stone or something is there, can be seen in the x-ray. And along with that, we can have cystourethrogram. Cystourethrogram, it is one kind of the process in that the dye is given through the catheter to the urethra and bladder, and then the series of x-rays taken to know the obstruction or any structural damage. And other the diagnostic tool that we have is the intravenous pyelography. It is like uh, intravenously the dye is injected to the individual, and after that the series of x-rays taken. And if the diagnosis is not get confirmed, the physician is not surely enough to know the exact problem, then can go for the other like CT scan, MRI. CT scan is the computerized tomography, which is the procedure which is done to take the cross sectional image of particular organ. And then again after that comes the magnetic resonance image, that we can say the MRI. That is also one finest diagnostic tools which is done when the physician is not happy with the CT scans result, then can go for the MRI. And these are the diagnostic tools that we use for the urinary tract infection. Um, um, as the normal urinary tract infection can be diagnosed with the urinalysis, urine culture and sensitivity, and the ultrasound. But still, we have not confirmed that actually what is the reason behind of this. Then we can go for further investigation and all. So these all are the diagnostic tools that we take uh, for the diagnosis of the renal system's problems. So all kind of the problems of the renal system can be diagnosed with these tools. Next, we'll go for the medical management. If you talk about the medical management, we try to resolve the problem with the conservative treatment. So the first step of our B, assess the general condition of the patient. So we see what is the health status of the patient, what the problem actually that person has. So we can see through the vital signs, taking care of the vital signs, and by observation of the things, by asking the patient, by assessment and all, so we can know these things and all. And after that, we go for the symptomatic treatment. For example, the person has fever, so for the fever we can go for the certain antipyretics medications and all. If it is prescribed by doctor, can be administered to the patient, can be given to the patient. And we can use for, if the person had dysuria, painful urination, something like, so we can go for the urinary analgesic. For the urinary system, we have the other analgesic that we call as the urinary analgesic. So like pyridium, urispas are the example of it, so that can be given to the patient. After the other symptoms that we can expect in the patient, nausea and vomiting. So nausea is the vomiting sensation, feeling of the vomiting, and vomiting is, as we know, expulsion of gastric content from the mouth. So that is the vomiting. So we can use for the antiemetics and all, for like MSAT or something. The medications are available. After that, we ask the patient for having plenty of the water. So in 24 hours, 3 to 4 liter of the fluid intake should be advised to the person. Along with that, to control the infection, we can have the antibiotics in the consideration. So many antibiotics are there for the controlling of the symptoms or resolving of the infection, amoxicillin, levofloxacin, Vectrim, etc., and along with that many more antibiotics are there that is taken in the consideration to control the symptoms. And now we can have the urinary antiseptic also, nitrofurantoin. This is also one of the drug which is used to lower the impact of the infection. But it should be keep in the mind while be giving the nitrofurantoin to the patient, he should not have renal failure or something problem, because less than 50 ml urine output in an hour if there to the patient, then the nitrofurantoin have a problem too. So it is avoided in such people, those who have the renal failure. After that, we have like the patient who has recurrent means again UTI they have. So as soon as they have the symptoms of UTI, they should consult with the doctor and have the medications. And after that, if the relapsing of the UTI is occurring, then we should have for that the short course duration 3 to 4 days until the symptoms. And sometimes we can have the preventive low dose of the sterilization of the urine, like trimethoprim with or without sulfamethoxazole. So at the night bedtime is often prescribed, so we can have that for such people who are having the UTI again and again or relapsing of urinary tract infection occur. Now we'll go for the health education. So what the health education to can be given to the patient and to their relatives, so how it can get prevented to happen to get happened. I'm sorry. Do not delay urination when it is necessary. It should be kept in the mind. If the person feel the desire of avoiding the urination, it should not be held immediately. The person should avoid the urine. So that should be kept in the mind. And after that, we should have plenty of the fluid, like I have discussed earlier in the conservative treatment. So 3 to 4 liter of the fluid should be taken by the individual. The reason behind it, like as much as the fluid will be taken by the patient, so much the flush of renal system will happen. So the accumulation of microorganism and multiplications or presence of the microorganism will be less over there. So that is the reason high fluid intake is advised to the patient. After that, certain points should be kept in the mind, like cleaning the urethral meters after intercourse. He has been shown to be some benefits. Those who are the sexual active people should keep in the mind before and after the sexual intercourse, they should void void, that means they should pass the urine. And with that, drinking of 250 to 500 ml of cranberry juice daily should be advised. So cranberry, the juice comes like the lemon juice and certain kind of the juice which have more vitamin C contains. And also the person who use the bubble bath and all should be avoided. Bubble bath or the bath in that we use something like soap, like the soap which provide good fragrance and the good smell and all. So this kind of the bath should be avoided. And the peoples who have recurring cystitis, that means urinary bladder infection or urethritis, something like, so should be given a long course of low dose antibiotics that I have discussed earlier, like trimethoprim with or without sulfamethoxazole. So these are certain preventive measures, and another word we can say as the health education. So these should be taken by the consideration by the people. And so this is what the urinary tract infection, and I hope you enjoy it. And thank you to everyone